Oh, hello. Mr. Good to see you. Today, you've been prescribed Pregabalin. Pregabalin. Okay, so I know what you must be thinking. You must be freaking out. Like, what's Pregabalin? Why have I been prescribed it? What's happening to me? It's okay. In this video, your local friendly pharmacist is going to break it down and explain the nuances of this medication, like what it is, what it's used for, how to take it, things to watch out for, and so on. So let's get started. This is a very valid question, and in my experience, one that people don't probe deep enough with their prescribers. Saying that you take a medication just because the doctor prescribed it may work for some, but I want you to leave here with an understanding of why. And that way you can make informed health decisions. Now, while I can't say for sure why Mr. has been prescribed Pregabalin, if I had to guess, I would probably say it's for some sort of nerve-related pain. In Australia and around the world, Pregabalin is prescribed broadly for two things. One, as an adjunctive for treatment of epilepsy, mainly partial seizures, or two, as a nerve blocker in varying forms of neuropathic nerve-related pain. Now, there are many different ways in which our nervous system can be damaged, resulting in nerve pain. Some of the more common ones include uncontrolled diabetes, resulting in diabetic neuropathy, a bout of shingles rash, not treated quickly enough, resulting in long-term nerve pain around the rash site in post-herpetic neuralgia, or you can suffer a significant physical or psychological trauma and develop long-term nerve pain known as fibromyalgia. Then there's the other indication for Pregabalin as a second line or adjunctive treatment for poorly controlled epilepsy. Now, I don't know about you, but I don't know that many people with epilepsy, and I'm a pharmacist who sees hundreds of people every day. So, as you can imagine, the vast majority of prescriptions for Pregabalin we see are for some form of neuropathic or nerve-related pain. A fun statistic for you, in Australia, Pregabalin was first approved in 2005 only as an adjunctive treatment for epilepsy, and as such was barely ever prescribed. However, in 2012, you guessed it, it was approved for the treatment of neuropathic pain, and by 2019, it was the 12th most prescribed medication in Australia. This depends on who you're asking. To some, Pregabalin is a life-saving medication. To others, it is a life-ruining drug that has led to dependence and addiction. But if you were to ask a chemist, not a pharmacist, but a chemist, then Pregabalin is simply 8 carbons, 17 hydrogens, and a nitrogen dioxide. Okay, but what does that mean? Well, not a lot unless you are a chemist. However, what is interesting about the structure of Pregabalin is it is an analogue of GABA, otherwise known as gamma-aminobutyric acid. Now, GABA is an endogenous or natural molecule found in our nervous systems, and its job is to calm down overactive nerves. When Pregabalin was being made, GABA was used as a target molecule, the idea being, if you could create a drug that was similar in shape to GABA, potentially they would have anxiolytic or relaxing effects on humans. Now, whilst Pregabalin is similar to structure to GABA, it does not actually bind to the GABA receptors. Instead, it binds to a protein on the nerve terminals known as alpha-2 delta subunit of presynaptic voltage-gated calcium channels. It is believed by binding to this receptor that Pregabalin reduces the influx of calcium into nerves, which inhibits the release of calcium-dependent neurotransmitters such as glutamate, noradrenaline, serotonin, dopamine, and substance P. Okay, so in a nutshell, Pregabalin enters the nervous system, binds to the alpha-2 delta subunit, which inhibits the influx of calcium into the nerve, which reduces polarization and stops certain neurotransmitters from being released. This results in a reduction in nerve excitability. It must be stated, however, that this mechanism of action has not been proven and is only a working theory. Pregabalin comes in 4 different strength capsules: 25 mg, 75 mg, 150 mg, and 300 mg. And whilst you could take these through non-traditional routes, the predominantly accepted method is to swallow them. Now it's time for a quick pharmacokinetics lesson. In pharmacy, we like to talk about medication pharmacokinetics, or the science of how medications are absorbed and metabolized in the human body. If you take a single dose of a medication and you were to graph the concentration of that medication in your bloodstream, as you can see, initially, when you take medication, it is absorbed and rapidly the concentration increases until it reaches a peak, and then the body metabolism begins to outpace the absorption and the concentration returns to zero. For medications to have an effect, there is a minimum concentration required, and doses should be timed to ensure the absorption and metabolism are balanced, so the concentration in the blood always stays above the minimum concentration of effect, but not too high to cause side effects. Dosing intervals for medications depend on how quickly a medication is metabolized, known as the medication's half-life. Pregabalin has a half-life of just over 6 hours, which means 6 hours after taking a dose, approximately half of the drug will have been excreted from your body. If pregabalin was dosed once daily, then by the time you were due for your next dose, there would be almost no drug left in the system. It is because of this that it is recommended that pregabalin be dosed twice daily. However, one of the biggest side effects for pregabalin is somnolence or tiredness. And to avoid this, it is recommended that you first start taking it once daily at night. After a few doses, your body will adapt to the medication, and then it will be easier to dose in the morning without it putting you to sleep at work. Speaking of side effects, fortunately, pregabalin has a few. As a central nervous system blocker, pregabalin is fantastic at reducing nerve pain and improving seizure control. However, our brains are complex, and pregabalin is not a lock-on missile only targeting troublesome nerves. It is indiscriminate, and as such has been known to cause the following side effects. From most common to least common, we have dizziness, somnolence, tiredness, blurred vision, fatigue, weight increase, dry mouth, headache, ataxia, otherwise known uncoordinated movements, peripheral edema, swelling in the outer parts of the body, tremor, constipation, nausea, confusion, memory impairment, vertigo, and diarrhea. To put this into some perspective though, the study that these side effects were taken from, known as the Pregabalin clinical program, side effects were only reported as mild to moderate, and whilst dizziness was reported as the most common side effect, it still only occurred in less than 5% of patients who were given pregabalin. Whilst potential side effects with pregabalin are luck of the draw kind of thing, one outcome from taking pregabalin that is certainty, especially if you've been taking it for several weeks, is when you stop taking, you will experience some degree of withdrawal. Now this withdrawal is a natural result of your body getting used to having pregabalin around, dulling your nerves. As you take pregabalin, it is lowering the excitability of your nervous system, meaning it's harder for action potentials to fire, and it makes everything in life less painful. When it's taken away, then the nerve excitability increases dramatically, and everything will become hypersensitive again. Withdrawal symptoms include insomnia, nausea, headache, anxiety, diarrhea, and my personal favorite, hyperhidrosis or excessive sweating. In my experience from speaking with patients, the excessive sweating is a big one. Can this be avoided? Of course, you just need to withdraw your dose slowly over several weeks. For example, if you were taking 150 milligrams twice daily, Then you would speak to your doctor and get prescriptions for, say, 75 milligrams and 25 milligram capsules. And you could reduce your dose by taking 150 milligrams in the morning, 75 milligrams at night. Do this for several days, then take 75 milligrams in the morning, 75 milligrams at night. Continue for a few more days, then 75 in the morning, 25 milligrams at night, and you see the pattern and you continue until 0. This is just an example, and it would all depend on your current dose. So if you are thinking of stopping pregabalin, please talk to your doctor first. Pregabalin has abuse potential. If taken at higher than prescribed quantities, can cause feelings of euphoria, relaxation, calmness, as well as dizziness and sleepiness, obviously. Many describe the feeling like being drunk, and if taken with alcohol, it will also increase the effects of alcohol and other drugs. As stated before, even with taken at prescribed quantities, pregabalin causes rapid dependence, with withdrawal side effects, making it difficult for patients to stop taking it. Patients with a history of drug abuse or addiction should be carefully assessed. So now you know a little bit more about pregabalin. It is a powerful synthetic central nervous system compound which is prescribed worldwide that can have very positive impacts on people suffering from neuropathic pain or with poorly managed epilepsy. It does unfortunately have a name for misuse and addiction and can cause serious withdrawal side effects. As long as it's prescribed and taken responsibly and used at the lowest effective dose, then it can have a lot of positive effects on people's lives. Thank you for your attention, and until your next refill, stay safe and stay medicine wise.